MOH EOC program gidra every Wednesday. Update sa mga direct tawara mental health awareness. Elang mental health awareness week. Makatamo marurute gito program gidra base lagi gidra blaktung. Sa dingwa Michael Gumsang kafar ngiya coordinator supervisor gidra gidra talk show. Madungum sang balomura program gidra algo sing. Ngil musing legor ka kafara may kamla eko.
Aman sulang Mr. Diaz malungil ko singin mo raw marukul nga superstation nga WWFM. Gidirek kal brenga sulir ada nga Dela malol willing obungget sel vehicle temela talk show magidirek kal malureng ra ngil ko singin morti. Of course mal yurang ra malungil ko singin marukul listeners ra sel Bela makuk will sales in morti gel possible joiner gidra online mara outside.
I see.
Tuli gumal to ka amnado basin sa last the kaptera milidyul na talk show. And the Weigel Blamdo nga gi mal bring a sulirar guest ra gidra lalgop singil tira adra ngania adra division of behavioral health del Ministry of Health ma direct kala other cell Palau Behavioral Health Council. Gi bring a sulir ngatya nga Benny Brel ma direct kal Rondy nga Psychiatrist Council ma direct kal Dr. Dela Cruz niya flow regular namo regular lobong gedra every so often na talk show magiman bring a sulil no sabil lobong gedra algo susul mamsa sa gid mental health awareness day ma mutal bebira ku kora activity bol lungot mo kay al 2020 ilgidel sa gid sil sa week ra mental health awareness. Hello, Bungeda, always Incident Commander, Tel EOC, MOH, Tel Udoy, Director Liaison Officer, Director of Public Health, Chairman Raisao, PIO, Don Microdeo, Director Safety Officer, hanggang Director Chief for Division of Behavioral Health, Evelyn Tamangin. Magi-bring nga sila metulig, marugul adal nasa i-join, naging di mo follow sa loyal format rigid. Wala to continue regular updates di bok biskit ako rakdebel lulaklat kalgire la COVID-19 may gel lora bebira tokol sa edel kaingesewra adolong ulit kalkat kara tokora prevention tegi del rakt. And then ako mo mas mistira adra blue updates emro ko te al mistira adra tegi del Palau Behavioral Health Council matukok mo tegi del partner program. Ya wera po to mereka nga ni sa gidil question mo tuwira gel pokto mo tegi del educational segment as always single first la dal golra den wara PIO malubong caller sa gidil 488 4601 correcta answer ngi ang sa gidil al price.
I see.
Tulig mo tegi kada mesra blurang var sama tokol blura blul adal cases ringin of COVID-19 etamla mo o sadra mask face covering malubong face mask uspalela mask right prevent the spread of the COVID-19 sera walele tuligra umultat pandemic ra sila ongerulbuy hotelbuy ongerulbuy alirang kuratim la kamal emphasis ra mask. WHO ma CDC ako ati dilulwasel sugum kasme mo mask mo igital la mo tabangi lwaset by the masking safe for everybody mong sige di ako kora teletare lang regel belul ngariya cases ringi of course sige da ngatangat talaga mulmol mulkora salba akal dila kamadang ra sila bulwad sme tiarat. In the event mo ringi case of course gira dal ma ulingi travel kla dal wasebo do o mask make sure and the spread of the gidil the COVID-19 do mask o sisita magda mo practice physical distancing even matsugo man dia ka symptoms sige dia ko kora letay le so mo kadam au mask kay gida make sure sit tel mask gida ungil cover amada mga red hindi akal kura nganyam teto ngil sa el so bada gida droplets sa sumo ko kluk lumalubo ko ngos ungil al multi layer nganya more than one layer tel mask and at the same time ngil ko تلقيب المدينة من داخل كل وقول مقدمة التليم سامل خف كبلي سبيرني ويلو تليل.
I see.
لكن بتوقع هيجي cloth mask توليك اللي هي موضع surgical mask اللي جلدو سبير السيل hospital ما clinic السبائد المسيل كما يجي كده ديريكت السبائد المو أو start الغور أومس يوم ملوكم سوكم سبائد الوقتي كده المرس ما يقدر المرس مع ماسك كده اللي جاي كده سبائد الوسباء يسيل بعض مرق الوسباء يقدر بوكسيل جي من سبائد الموت الوسباء جي.
Kam stoberti la ela sendu msil ngeral sop malum kloras kami medetria atletel omsil ka.
May sa kung daso tuli ka kaidan sa lang ati kiti msil garingil waldil partra award rover kaul waldil partra bilem rabekal sil so lo mulo tungin am msil garingil ospay di regular laundry detergent not necessarily monia bleach yang ya sabel cook wal cleaner ngi yal sugo mga niya armela atre termalubit tegit covid en sabel mogodir malubong mubitir say direct ka sa edal di gid msil ko lola ba di msil graim lo spegal di regular detergent
Ya sabedem riaran mengun silgin diwin.
Yung sabel ngungil al kurang ara warm malubong warm water to silgin.
I see. Okay. Got you.
Masaygi de tulig mong di parental guidelines so sendia kato malyamas karagi kalingal ngariorgil wal under 2 years old talgibel mo uncomfortable ti hindi 2 years old mo ba sugo mo magila do masking yung ngila do mask bekla hindi osisil time tulig at sel do mask kada ngila del الملاس ملديا قبض دي دعنا دورة ارتل ماسكر جي ده برا مورتي مو روترا table ملوبون ركل basically it's the same concept that there preventive measures so sila di do rootera mata da may sigad mangre posisiyo ado mask umda sindi gigi tuli ka kukora sa edel share la gusus
Okay.
Kabo da kan move the question.
Hindi akong di domestic kurang ada conflicting issues related to how the distancing, the way we wear masks and domestic was CNN, Fox News, CDC, ako mlari pila bebira gelulugoy el tugora ngaramong dia ka korap es ngara CDC mail gire del moment ngay.
Ngora dia ka kung sa tulik sa lukura ba is nagto dra CDC acknowledge lasing gayid el SARS-CoV-2 gayid el virus sa sabel ngara igel mal bigakadel el droplets malubong wal kora airborne sabel
Okay.
sing airborne hindi dia kalukul sal el mooroid ending tamla acknowledge sa oing sabel lo mesring lasing airborne sige do kung sing hotel kora cloud change la lalo tabdil kuk basal guidance mga guidelines tegi del COVID-19.
Okay, isulang.
Okay, so tulik for the first time in a long time yung di imola ang mandatory quarantine ila. In how many weeks and portal kuk temela talk show ila ka adal nga quarantine tirigel rohuil la quarantine last week lo dimo tirigel 7 del soldado nera September 21 tirigel longra legel bilis legel K9 tirigel terung military liaison officer samlo sa bedel tested negative tumle release del al week kita madinge tulig lo se set klo lomra last week len lara Nauru ma Marshall amle dimo tira 4 crew members sa Air Nauru. Itirgemle originate Australia. Makadamle quarantine quarantine site at tila selsil sa Lorar sa Sabadong October 3. Thankfully, itirgel rogul mle delegation na Nauru, Marshall Islands, itirgel rogul crew members sa Air Nauru, Miguel 1 resident Lasabel Masala Air Nauru May. Habla de test tiroguy tamle negative sa arrive itigay gid tewang actually hindi tamle tirogul 10 crew members naurusera l'oral selsil sa l'oral kada lilug til testering maldi tester maldi make sure lasen the negative raw l'oral mlasa gut muklisay fortunately tirgay rogul crew ra air naurun latang ludi muk tirgal tewang nara le originator Australia crew sel skogi am le negative raw l'oral
Elangil local residents el almlay ang direct mla require mora quarantine ko korasem jaga adal ngara quarantine lang ngem di mle 1 week and 12 da
Moise tulig lang lara basyol dia case ringi kita bukti follow ra gel existing protocol ringi hanggang adim la part ra a delegation ra either Nauru Maluba Marshall Islands makadam le consider ringi while repatriated the resident del mutal merbela maul makadam le impose sa gid 7 days mandatory quarantine game le sebel test le sedel test ringi ra elir sel day 7 ra eli la sebel tobre lang lubang negative result kaya lang ako malumol nga self monitoring and move till additional 7 days para di limit the movement ringi mo regel essential laboring 7 days move till test next Tuesday
okay ya kabes at tugol girel sel nga raul tasul wase twice a week United Airlines from Guam to Palau and back
Kora dirga ka ba is update til girel se tulig
okay
Kora malmol di monitor situation ra Guam matangil waseng kora the fluctuate the number of cases and this still mal kora hotspot tablu ra Guam tuguni sel do mesa Nidi sira adal mother tial raktara belura kwaming malgora unfortunate mutan nga niya teru los male mother lansil simong kada mulmol mul ngara parang lungu ngira la belura kwam Michael Becker belu affected tial COVID-19 hindi sa lomes ra kuktokara tele las kogira kwam me tuli ka kundas for now kada still kada kora dili ka sula sing na dili ka kalbol safe
I see.
So kung hindi ka niya gigid yung lockdown restrictions sa Rabalu, ang kora diya kal lungilan nga niya lockdown Rabalu gito.
I see.
Atal may.
Okay.
Hindi maringi sa gito skogil mera luko rakap sige malumuto tara Friday nga da Taiwan and May. So ulta ka tigay gid luko mlamo mera ka Rabalu medical referred patients sa Maris Court sa mabibir essential workers nga Taiwan may takar argidil mora referral luguk maray sa mera klugo rakap sagay malugong early morning Friday
okay
direct le tulig ang niya one raskogi der soldaw mera October 9 el takar 8 el soldaw tirang niya rally rebelo makada 3:30 tirga na umbre kan mesoy sa quarantine 14 days test 3 times kita mangira sel negative test result 30 gidil submit ra weral albelsi sa blur belo
okay kahalo gud ela tirgel soldar ela selmen government ram rigela tekertir agel quarantine sites el borngi al obe government bela amru sel quarantine peringi tekerngil giri tirgagi de soltan merabluat
nda malungil kere tulig o tirgel soldar amrigel rogul level 6 benditil hara or quarantine tir indi tamora basyol government terbela wa designate tingil quarantine site
okay
lagi oriol bungal ngegid liaison officer military liaison officer attached til mora US embassy lagi gid el beklo maral megi modong okle smodi at tele lo omra el basemo ngarang quarantine tit follow ra gay gid existing el policies rigid o si silta metulig serai delisabo October 5 ekdam le reissue a Ministry of Health Directive 200/20 while supersede el Directive 170/20 authorize isolation ma quarantine tegi del COVID-19 ma-close ko na difference nila ang arsegi del BSL directiva kada mo require our local travelers and mesoy sa Brel el-giri del self-quarantine at least in 10 days el-rawera al-top del maral merbelaw so si time kada both del mo require one additional test el at time makadadi require kadamle require one test negative test result la submit 72 hours ra where to dra abalul ngaringin merbela wala kadamo require tablong one or cell policies per se gidil self quarantine period of 10 days ma one or se gidil 72 hours ra where nga sa skogil mengi gidil submit gidil tool result so se gidil ako klol change se gidil directive ra to ra quarantine ra adal mesois ra abalul belaw.
Okay.
Nati gidya no sa edel stira adal abalul updates to league of course ano niya question in say lumodong maluk the text and bersegil den wara PIO 775 1138 at so kung di ka mo del question tuli ke bike pastiriat de adara division of behavioral health ma Palau mental health mental health council behavioral health council
okay
balguk kalbol olmol mara selguk segment ra
okay
kasus
all right sula kafar
Halungin kapsangay tulir
mo ko basingay
nga kal Rondy yakuk mukti sa lukunya kal social media radio personality host buklaya sa lukunya kalong teera office sa Palau Behavioral Health Council naging akta ilal kapsangay lo kungela chairman or kamam chairwoman or kamam al Benny Brel mang paitswa kalpay makot sa teelel manukura welcome merkidal kilal tial المرال World Mental Health Day.
Okidoki, thank you.
Mungkin sengat tulir.
Mungkin sengai.
Aku mereka sulit pelolor yang sakti biak pelol dengan tiang.
Okay.
Pelolor yang sakti yang makaman masaura ang wilul ngasuwi malmera ablul belau.
Okay, sulang.
Aku mo Rondy ma toktang ako pastari natin alam matamo small behavioral health mental health awareness day October 10 2020 Michael ki mongat mok pulmarul mongat mok al sirte gidal Sunday nga hadi mo do ela se sel to di mo support tayo gidal gibomorul makwa kira ulaulan sa atoktang Rondy tamo leave us on those two things.
Okay. Sula.
Okay, so tiang amal kura me sois bra kura amal tito le time ra el al time le katanga pandemic and the el boringa pandemic mental health kura already one issue before already one Lurala number more bab, right? This year are other mental health conditions are there. Sabulul other and there's about 480 million other live with mental health issues and conditions. Among semen kura diomes number kuram tingin na say close to 3 to southern especially during pandemic. Les el tema la pandemic mar adal bol the bora lockdown matukura di nga back to direct le gelo setiang mesois babel wadan dia en mal close to tele la the switch a focus regid el mora mental health le say agora why al theme del World Mental Health Day 2020 mahalabok tali mental health for all, greater investment, greater access, everyone, everywhere. Mental health, ato tong lik mong right tapet ladro huy, gira del mlamom tangit mo tiaklo tutelel, makadana mo gira del katmok gira la mental health, el diakazil ngaringin ting ngaringya quality service gira la mental health. Maulat tiya kora malungil theme el alra mental health for all, greater investment, greater access. Awal dulu semero the switch of focus del mora ma priority del mora mental health, the invest although the gira la mental health ling for example atora suicide en directal mal lang mas atora suicide especially Palau el kadadigaw tingin rokuy tingin asing mlamo to a suicide compared to before. But not only people and mother suicide, but attempts attempted suicide man direct al mlamas a number ni. So with that thing guraway al mal attack tagid al theme al year mental health for all, greater investment, greater access, everyone everywhere. Guraway al lokotong al morar bet la adrogul el altamia tagid al obis Palau Behavioral Health Council, la Ministry of Health, ngarinya program lagi mo kira awareness mental health gim ko focus sa mal kira mental health mang while blabol kira del ko ay sa ga role agency la blur bela lo say may the prioritize mental health. But let's talk about mental health, and we're very fortunate to lose Dr. Dela Cruz. It's very nice to meet you actually. But you also have a nickname, Dr. Bing. Oh, I say.
Yeah, that's why I thought. I said, well, that's Dr. Bing, and then he said Dela Cruz. So I said, you got a new psychiatrist with us tonight. Okay. Rondy kami. Tell Altorbela. So Eden Bulu say mental health and bleed Is that the right way to say it?
Yeah.
Mental health other bleed
thinking, our emotions, and our behavior. So that's how we define mental health. Okay, so we should take care of it as much as we take care of our physical health, because especially during this time of the pandemic, okay, much emphasis has been given on the preventive measures and taking care of our physical health. But as you can see, even if we don't have a COVID case here in Palau, it has also its effect on the mental health of our populace, of our citizens. Okay, so we can see an increase in the cases that are coming to us in the outpatient, and also our patients who are out there, they're also being admitted. And in fact, our ward is full right now. And, there are the patients who are admitted spend a longer time, because also we have our limitations. So we also the resources that we have right now is limited because of the limited cargo also that's coming in.
Right.
So we're also considering the availability of the medication. So that's a very important issue right now.
Okay, you say that the number of patients is increasing right now. Can you say that due to pandemic, the number of patients is increasing? Can you say that?
There are patients who developed anxiety because of the pandemic, and there are also foreigners who are stranded here, who are coming to see us because not just because of their anxiety level, but also some of them there's a lot of uncertainty with the current crisis. So there's a lot of stress that they're dealing with. And of course, there's the unemployment because some of them got laid off because of the economic situation, which is not just happening in Palau, but all over the world.
I see.
Yeah, so there's a lot of stress, anxiety, and depression going on, and it also has some effects when it comes to suicidality. Okay? So that's very much a concern right now. Okay, so there have been some attempts,
right,
and hopefully we get to address all of those problems.
Yeah, masaygi la korawal direct hotel mental health tulit mental health direct how well do you handle stress, how well do you relate to others, and how well do you make choices. Matiamal affect tra blagar de leda other velau ma ayel el tretele da daad adu ma direk kal tele la tom daswa
I see.
o saya kura wayal mal al balkula a mental health lo otiaklisi el out the sweat marmus o saya kura wayal mental saya kura wal al lomso de la mental health del doctor Palau la klisi ela out the sweat marmus say mental health.
So in other words, tial sel salmo o toka mondair tial telum elam como ring lom daswis so lang en sabel segi del process el com daswap tokoi problems tial pandemic and sabel direct drive you into a suicidal thinking mal oben araba sel de turgolom daswen ngari atleteria said take the quick way out.
Why say?
And that's brings this next question is, do you have any telephone number? Let's say that I got so much problems and I don't have no one to talk to. Do you have a telephone number that I can call and then have someone talk to me and kind of ease me down, you know?
Why say, ma obviously given mom ko tong la mental health.
Yeah.
Obviously behavioral health. Yeah, then one year 488-1907. Say then one cell obese. Hindi kita nga niya hotline na gidel other bela tam tangali el 775 talk.
Oh, 775 talk, yeah.
O saya aden wal el giblam setter ngi el gora wadi ndagim identify la sing tangkal adal ngata denwa ending wal anonymous el adal sabel help rangi dil adal el gora ngarinya dang lelar ngul malubong kram bring out the swell el sorry el kora ospe ang seu en sa ilom ko tong sige del 775 to mga tadura.
Okay, come and translate the cell 775 talk la sing ran number sing 8 to
8 ang coming ang
5
8255
okay
775
yeah
8255
okay or 775 talk
I say
okay
may lat tagi del dengwa sa emlam ko tong ringil el qol al sum ngarinya ko ra ngidil el qora amring ra the swim ring ra le say why al lolong sergi del gire la mental health and the tial obvious behavioral health direct el open obvious ngira 8 total mo 4 p.m. 4:30 p.m. ra pero sils ra Monday to Friday el direct el mes tapay mestria adlo ringi yeah so mental health mal close to tlel el tara to el dia kadlo ol masader ngiling hindi ka desang kadom dasol mong dal exist mang selbebiak tam kadom adura asia ada mas arngul kita mas arngul direct le kadom dasa sing kata kagiren mas arngul mo adura ngalway say ending direct kagiren take into consideration na sing ngarang ako go through ngingal you know mang kadakay ng zero especially el temela pandemic.
Let's say lang nga kasal so lang a problem nga have something to do with men, so I want to talk men to men. Ako let yan number and the deal kurang rela 18 19 argil makasi never mind hoy sen lang sa the moment ngel was say umgok ko la sensohan mga dura ako la sige 488-1907 ya adel answer opposite sex of who I am and what I am mang ang sige the problem asu morning and so the request was say me gungo dura klol other deal mal oben klol other sal
I say masel 775 talk manjel adel direct el answer sel denwa man direct el mok el route tra denwa mora right el adel mo o mga adur kaw o direct el nganya setra nganya set el questions el logger el direct el logger kalwa say ka comfortable mo adur tir malakal sa the route tra mora right el adel el mga adur tir
okay
the direct el mat prepared el girel say
okay yeah very clear.
Yeah, so back to World Mental Health Day, tiagi del el kurawa kulkorngil waseng theme awaya lokotong el mora rokul adel wasem ko the focus ra a mental health el pandemic ling celular mong dia do ngel waset yang mal mo wangaranga affect ngira economy kid ma balwa mang kire del prepare del kire sel dokora di bigikl rabek time say man direct ngangi al affect ngira health kid mang ulang mal close to telela the mental health and more priority ling mal close and affect ngira tingit mang the sweat marangud ma atele la deal ra tial pandemic mang mal close to telela the focus ngi mang ngora na swa loge la toktang since ngata toktang direct la say what are some warning signs bukta so saldo mesa ading sa vitamin daw niya na say nga mental health niya na start to deteriorate even kaul adam direct ka mo niya na say nga mental health nga ka amla mo stress at taka dio mesa Facebook mang malmla mo close stressor raw alung taka oy maseligang ang taka dol asware al ubi mental health kita direct kalmla mo affected mang direct kalswa del mom tingin la say nga ko ra kelo lang alela kurawal maami ituut del mental health agit. So what would you consider doctor are some warning signs for a deteriorating mental health?
Well, those who are overwhelmed with anxiety, depression that has been going on for a long time, okay, and those who are manifesting with clinical symptoms, such as losing interest in what they're doing or pleasurable activities, having disruption in sleep, okay, and appetite, and of course, when you notice that they are having functional impairment in work or in their studies, and having a problem with relationship with family or other people around them, then this may be considered as a warning sign of someone who's manifesting with a clinical psychiatric disorder.
Okay, all right. So I get that for a baby a warning signs. Tuloy nga magtirek kaldak tulo sak mal kura awang naman ding nga magtirek kal sel baby at time ng affect mental health nga ka tukoy mang sel baby at time bukre atrapliga was ka mal lagay na weight le ka mal stressed ultim dangin la sak na kay na weight le woktik mul di abarera adem kas kelang
yo mo kara ice packs
sige di yo mo kara ice packs
Oli tangas elar mo
baby ra ko lang ale de kita ada Palau la say na mo get ko take a break.
That's right.
Focus on mental wellness.
Yeah. But that's, Rondy, let me tell you something, like we have a tendency when we have problems, either we take it to alcohol and try to ask alcohol to help you with your problem. And some people are taking on hard drugs, illegal drugs. And some people take it on food. Like,
that's right.
You get so stressed out, to keep you busy, putting all kinds of trash in your mouth, and next thing you know, you're bubbled up.
I say so. It really affects our addictions as well, and the more look for other alternatives.
Right.
And apple by the gidel to malapit.
I see.
So that's also a good way to a good example el direct lakal lang malulis el patukar other sort to food, and even nga kamang selbe bilata makase well, at least takal la takal tor na selung yeah, so the gida ko na baby na example, and the nga chairwoman ng gidel direct sa el share a baby na experiences ng direct gidela a mental wellness.
Okay.
El World Mental Health Day katong ang talwasen korawaya lokodong al monarokul agencies and ding direct kan lokodong al monarbek la adrokuy alwase take a break relax sa mind the commute bom pora kadarang anak mungger biwara al all relax like ay kaya kita lukuran ways to reduce stress. So nga kita doktor ngal direct kalngatyan. So maybe we'll start with doctor. Maybe you can give us some ideas on how to take care of our mental health.
With stress.
Yeah, with stress.
With PTSD.
Oh, PTSD. Well, with PTSD, if there's clinical symptoms, you might need to take psychotropic medications also.
Yeah.
But to manage stress, so some tips for stress reduction would be to get a support system. Find someone to talk to about your feelings and experience, okay? And change your attitude. Find other ways to think about stressful situations. Find ways to reduce this because life is 10% of what happens to us and 90% of how we deal with it or how we react to it. So let us be realistic, okay? Set practical goals for dealing with situations and solving problems. So you have to develop a realistic expectation of yourself and others. And then you should also get organized and take charge.
Right.
Plan your time, make a schedule, and establish your priorities. And just like what Rondy said, you have to take breaks. Give yourself me time, okay? Learn that taking time to yourself for rejuvenation and relaxation is just as important as giving time to other activities.
I see.
So you have to eat properly, get regular rest, keep a routine. Allow yourself to do something that you enjoy every day because you have to balance the feeling of being sad or depressed. You have to have to engage yourself in a pleasurable activity also.
Right.
And another important thing is learn to say no. Okay, protect yourself by not allowing yourself to take on every request or opportunity that comes your way. So when you say yes to others, make sure you are not saying no to yourself. Okay. And of course, like what I always say here in the talk show, you have to exercise regularly because when you do that, the brain is stimulated to release and produce more serotonin, which is the what we call the happy hormone. Okay.
I see.
Okay. And when you are feeling tired, you have to slow down. Okay. You have to know your limits and cut down on the number of things you try to do each day. Okay. And of course, the use of laughter or humor is a mature way of coping. Okay, so do something fun and enjoyable, such as seeing a funny movie, laughing with friends, reading a humorous book, or going to somewhere that makes you happy.
Or watch a Netflix.
Yes. Watch a funny movie.
Yeah.
And of course, you have to learn to relax.
Okay, let me give you a situation, Dr. Bing, and see if you can help me with it. It's not me, but I'm just pretending that, I'm the person with that problem. Okay, I have 5 friends, and I'm a person that doesn't, I don't want to say no to my friends. I have 5 of them, and I say, yes, we can go fishing, and then the other one says, let's go and drink coffee. I got something to tell you. So all 5 of them give me, something to do or be with them, And I don't know what to do anymore because, if I don't show up to either one of these requests, then I'm a liar, and I don't want to be a liar or called liars. What should I do to please my friends, so they don't get mad at me or don't trust me anymore, or just talk bad behind my back? How can I solve that problem?
Well, like what we have just said, saying no means taking care of yourself. So you have to be honest with them and prioritize what you think would be beneficial for you, especially if you are also engaged in activities that are stressful. So you have to think about yourself.
Be
also.
honest. You can
Yeah,
just be
so
honest,
be
right?
honest, yeah. Because if you lie, then that will take its toll on your
Yeah.
friendship. Yeah.
Yeah. Okay, so you have to me, you know, if it was me, I'm a straightforward person, you know. They call me all kinds of names, but I don't really care because I think of me first. My health comes first, you know. So if my friends, you know, 2 or 3 of them call me and ask me to do certain things, let's go drink wine, let's go and do this, and I cannot split myself in 3 ways. So what I do, I said, hey, look here, guys, you know, me comes first. I'm tired. I'm not going to be able to make it. I'm sorry if I hurt your feeling. Is that okay to say?
Yes, you told them the truth and you gave them a valid reason.
Yeah. Okay. All right. Thank you.
Okay, Mandilas de tulig kita chairwoman ngatiang mengkora direct kalswa del kora share experiences mga kora share loss and direct kal makarangal to deal with issues like that and other mental health issues kapon yung chair.
Kaman saula. Malsa dalo reng sa igal to ko like al biak po repeat aktiso al di share al wasay sel take care at yal mental health malubat yal wellness rakaw en kalmula igal to ko lungil rakaw al got mas emol nga sa rataraan sel lungil mental health rakaw e kapsa dal positive kawal nga sa lungil lebla kalum lekang ngungil at chos rakaw malubeng ngil tel lulda swim malum Omolulu, omol nga sergilo baudo, omol nga sergilo balal nga sergil mga smokra lang aklel, hindi ngungila siya sergal, ngungila mental health rakaw. Ang cloud to telele, eso algo para kira luasay, kira armla mo 55 and over. Katokaraman madakter selbo ngital pandemic alwasay, dirgi ako tel mosme.
Nice.
We will apply the same thing to our mental health alwasay. Malgira take care gid mungkin lumila aliwe nga malumra selwasay. Selumila aliwe elungil telgale mal balance en sabe mal mesawil tawoy. Masabe mal tuyakal mesangal karawsong sel tuler darangul. Nakal sel garangul nga haseru nga kamla kulureol me kasongal nga. Esel sugo mang hita aliwe ende kisa siya ki mo kauto aki mo kau mundar aki garel toy mang maral cloud to tell mental health al gidel wasay ngil ol da swe del ngila ngud ngil omra lev mang ber kadmo ngaldoy ata mo aada mo kadam sa el ela sel ngila mental health ni and then we apply it to our kids sa beral material aba mang piret cloud to telela tel mo dia kadalong lilwas o nga halbiya habiik dia kan necessarily work visit sa sister nga kasi akala ko yung morning in a very positive voice pawilar wal mahawilar mo kamang to kay gagi dal sab edal gut mo klemerula el gay nga sera dalong let mang amar nga leged mabalwad mang sabi edal diungila ang cloud to tell sial mental health awareness World Mental Health Day about celebrate the ngira October 10 luwase Rondy mosma dagal activities sel gimorul hindi maklaw to tell luwase rebekla adal rengs kahil maklol marangal ga lesel walungil health kita balwasa mongil belu
Masay
makti wala mul mori say give umbral luwase gidal activities sel gibom south direct dal dia kulkol ngin gira mal mo proclaim ngi makulol giren
okay
pekdal rahal darurat yang di el ragyang mal tokowet sel dokora mal focus the turn ay the swed mal ngudul wasi let's take care of our own mental health ma wellness ngi bolso el mo swira ngal bitar ngi
Masay
Okay, kaman sulang chair ma kita kora di i-baby activity mo ringi sa gilal seals October 10 ma sele ngar matong youth coalition and ngar along rura event and celebrate the World Mental Health Day lomo ra 9 o'clock mo 4 p.m. or sele ngar along state office masegi da hook mo ringi ngar along and then terminal Friday o Friday the 16th ngaringi sa mental health workshop al more providers, mga community partners, al more na West Plaza, Libu Street, no more 8 till mo 3, mas direct kalgim invite takal tulig ilguk me join ay gigit al workshop ang mamil gila mental health. May gigit ako at tablol activity, yakti reminder aro gula, ma direct classmates nga kal direct alwase takay na sewel roguy gila mental health. Also let's keep Palau pristine because a clean environment direct will help remind the gila mong sapelungil function. So since umang mal betul clutter and momring lagi da umtaso, so direct clean around your area, clean around your. But my mom says clean your room, clean your area, clean your environment, clean your community, and let's keep Palau pristine. Okay, Kafar.
Nakaman sulang Rondy, ikaw chair, Dr. Bing Dela Cruz, Berlin, Maroon. Walter Tegi del Tokora World Mental Health Day. Tulig aware daw simere wala po ko guest tegi del selger.
Ngariya ka kami tanga teso ka mo umuwi direct.
Alok mo okay na senda ka questions.
Tigi kami di ko ay gang ga Susan Merrill sebngil ko basngay Mr. Tulik Sulang share. Toldang sa ngara Portland, Oregon, and got my test result today 4 days ago. And it came out negative. And kita imong ngara Alaska, Mr. Tulik Diaz, I have to boil my clothes, and my mask every day. Len gihal ngarang ngak. I'm working with the homeless population. Mr. Tulik, we have to take care of ourselves first. Must wash our hands. Keep distance of 6 feet away. I'm in Alaska, and our cases number we're talking about 100 plus every day. El test result positive every day. Tirga ngara Alaska, matululu ulkirir. Tirga dengan Palau ngara Alaska, ma Portland, Oregon. Sulang.
Mansulang itulig bring a sulit tirga kita no sabi book share lo bungget kadangat yang pedang silang dirga ka matang smer tiara trabalwan hindi kita menangil sa tuktok baby gate marang gate ngara outside angara front line.
I see.
Tiagi da pandemic magi direct kalmal di mga lera bekla adala sebum karigi kragen ngarangi kay ngeseo adadu adrong lir book other Palau, kung ka tingin, so you'll support each other. Al kulakate al mermaid, tiakas kogi tituak la atetele la olidiul mermaid. Tulig aktil muktan morsel mlekari mara wasing tiar mental health ng adam laba malum bleed.
Okay.
Das so the blolom das sura selang siya tokol behavioral health malum mental health kadom das sura extreme. Das sura rak. Hindi akong das ang gira del mo change sa gira del mo message del tokol health hindi akal disease hindi akal celebrate the world mental disease. Akong das sa gira direct kal mal klol relate to lik del kamamara hospital makal ko klo influencer kar adrablu lo se what the change sa gira del paradigm shift sa gira lo singedra mental health del bolla ka focus sa disease eba ito both focus sa wellness sel Bekkal seal sa igen magkakaroon tokol dorulo sa makaras sa improve attitude ergid ma emotions ergid like katog klaro raring other Palau katog tokoy o klaro raring arogul tokoy aring lakadaled mong ngararing omraled mong ngararing magdesweta omu raring mahunda sa segid ya ako tong ergid other Palau mental health abay da ngar desweta bay ngararong I say raring ako din nasa share sa igit at tulig al sugum digamo al questions sa malumong concerns tibok kuget tegi del sel educational segment.
Okay.
Di werse tulig at iklutal loningit tra Rondy malutal miskita galdeng wa sumanya adlo late join agit sa inoram tingilo sa ngaral dengwa si ilo dengwa ngi el moringi ma mulum so that mental health day malumong igal services sa public
I say
behavioral
Masel dengwal mong kodong ringi 488-1907 Office Behavioral Health. Mal ube kong kodong 775 talk masel 775-8255.
Okay, so lang Rondy. Mitya kita, komen nga kita chair son mo
Hindi amek nga niya ako ulbes ngit to koy. Era bolol musuma ka farmal ubay bolol koy. Hindi sa ang mutyal te aleng te lamal nga Rondy nga atyang magi nga sulit digero kol frontliners. El bruro tiel uriyon. Ever since ralomo and direkta. Agi direkta lol baka baswam marang mami o maluluol betul kami o kita ko nga kaya makasakli malamol maraw pwede.
So lang chair. Tuloy mabuk kugat tegi del gas.
Come on.
Mal yagedra Lorenz mal attentive at sabel bol me right to lenser.
Okay.
Tablam sa dara togora spell la mask face mask malu face coverings. Tegi da ger. Ta nga dia for now based regel latest guidance ta nga dia lungil aluspera mask malu dia lungil do ba nga mask lumilani. Sige dia gere tulig matsungan niya mula sa catcher cell educational segment raw lo takang alcohol legit tong simra.
Okay.
Ako next week tulog tel may kaptera amalidio le in the meantime nga niya questions sa ada hotline ra MOH sa mandir open.
Okay.
Pala questions sa mga comments sa ada 488-0555 mga man sulang itulig ko mar ada ang rilbelaw maguk next Wednesday.
Okay. All right. Thank you. May gama.